It was fine.
You've been
It was much
more
better
than
than it
kind.
happened. So wonderful to have her.
I bet you had a nice Father's Day with her.
Yeah, it was great. She made me pancakes.
Ooh.
It was awesome. Yeah.
Tom used to
Thank
do
you
that
for coming
Tim.
to the aid of our
Make
garden
all sorts
club.
of
Oh, yeah.
chocolates.
Nice.
Sugar boost for
I've
the
been
morning.
fine.
But it was so fun.
You know, I've been fine, it's just I thought today I wear my mask, I should be, by tomorrow I should be okay. But then there are other events too.
Commissioner Mills, we're
You know,
live.
The
When-
schools
Thank you.
are having the workers' dinner tonight is like, I'm just not gonna go. You know?
It's hard.
It is, but it does say to me, I sat between a lot of people and I didn't get it, so it says, good. Good, I got my vaccines. Nothing else.
Well, I'm glad you're still doing well. How was your weekend?
All right, good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on Tuesday, June 21st at 8:30 a.m. Happy solstice. First item is the approval of the consent agenda. That includes our meeting agenda, minutes, financial reports, bills, and then PHHS Advisory Council membership. Is there anything anyone would like to poll to discuss? Also to entertain a motion to approve.
So moved.
Thank you, Bev. Is there support?
I'll support.
Thank you, Commissioner Svaleson. Any further discussion? All in favor?
Aye.
Opposed? Motion passes unanimously. Thank you, and that brings us down to the introduction of new staff. I'll hand it over to Allison.
Good morning, everyone. Really thrilled to be welcoming 2 new folks to the PHHS department this month. June 1st, Abby Benusa joined us as a member of our behavioral health team as a mental health worker. Abby worked with us previously as an intern in 2019 when she was completing her undergraduate, working with public health on the Rural Mamas Connect program, and for about 6 months served as a temporary member of our public health team with contact tracing and health education and outreach support. So we're really glad to have Abby come on board full-time with our behavioral health team in this really important role. So welcome, Abby, and if there's anything else that you want to say or not, that is fine.
No, you covered it really well. I'm super excited to be on the human services side. I've done a lot of work with public health and with so a new Grace now.
Well, welcome. Really happy you decided to join, and what an ideal situation for the internship and then moving into this position. So thank you.
Good. And also really excited to welcome on her very first day today, Melissa Wickwire to the PHHS team. Melissa will be in the executive administrative assistant role, so a really key support role, leadership role within our team, and we're really glad to have her on board. She brings a great deal of public service experience, most recently with the Grand Marais Library, so really excited to have her on the team and to welcome her for her first Public Health and Human Services Board meeting. Welcome, Melissa.
Thank you.
Oh.
Thanks for joining the team. It's a big role, and I'm sure you're overwhelmed already, but yeah, yeah. It's when we lose a position like that, it's unstable and just uncertain what's going to happen. And we're really fortunate that you applied and got the job. So thank you. Any questions for our new staff? Or anything further you want to say, Melissa? No? Okay. Very good. Well, that moves us down to item 4, our staff report. And good morning, Grace.
Oh.
Yeah, I can push the button here, Grace, and then you should be able to just flip through and super. Perfect.
You have to troubleshoot the technology.
Great.
All right. All right, can everyone hear me okay? Okay. been here before, but it's a new setup, so I'm going to have to take a minute and get acclimated. But I'm really excited to be back at a PHHS board meeting talking about COVID, but also not just about COVID. So thankfully, we're able to resume some of our pre-pandemic and our non-COVID response efforts within the public health team at this point. So, I know the board and the community at large have heard a lot about public health's role in the pandemic response, but I'm very excited to talk a little bit more broadly about what it is that our team in public health does. So, let's see. Okay. So we are going to start with a very COVID-heavy portion of this presentation, and then we're going to move into kind of the beyond here. So as you're all well aware, having lived through it yourselves, starting in March of 2020, we've all been living through a global pandemic. And I think with all that's gone along with that, it's easy to kind of forget what our core goals were in terms of the public health response to COVID-19. So in a nutshell, what we've been aiming to do has been to reduce human suffering due to COVID-19 in our local communities by providing people and organizations with access to evidence-based public health information. I think we saw that as a core challenge and a core role for our team, is making sure people had access to evidence-based information through things such as our hub sites, many media releases, radio interviews, signs and public communications, our social media efforts, and lots of one-on-one phone calls and site visits to businesses and event planners to try to help people get the information that they needed to be able to make informed decisions about their health during the pandemic. Another focus has been access to resources. So early on, this was homemade masks and hand sanitizer and making sure people had access to those things. It also kind of morphed over time to include more access to tests, to vaccines, also to link up to some of the pandemic-related resources that exist out in the wider world. So none of this was done just by our team, it was all done in collaboration. So for example, some of my colleagues in PHHS were much more involved with linking people up to resources. Mike Keyport and Jim Wienanen on the emergency management portion of things really took a lead when it came to getting hand sanitizer to our businesses, for example. One thing I didn't put on this slide, but I think is really important to call out, is that it wasn't just reducing human suffering due to COVID-19, it was also really allowing our healthcare system, and specifically our hospital system, the ability to continue to care for people so that it wasn't overwhelmed to the point of not being able to provide care. All along, that's been a key goal of the response, and it still is today. So, as I said, we did not do this work alone. We really took a collaborative approach to pandemic response. We worked very closely with our healthcare partners at North Shore Health, Sawtooth Mountain Clinic, Grand Portage Health Services, on everything from access to testing to the vaccination rollout, and then more recently to connect people up with antiviral treatments and monoclonal antibody treatments if they're appropriate candidates for those. Making sure that everyone who calls us with the positive over-the-counter results knows that there are treatment options now available and how to communicate with the medical provider to get early access to those. We've also done quite a bit of work with schools and childcare. It included lots and lots of planning on infection control, staying open, trying to minimize the impact of outbreaks of COVID-19. More recently with testing with the schools and childcare, offering that routine testing for staff, for families, for students. It also really serves as a pressure release for our testing partners at the clinic and hospital when there's an outbreak and there's suddenly, a few dozen people who need testing rather than 5 or 6 in a day. Within county government, we've worked very closely with, I think, almost all departments of the county to try to make sure that we could prepare well for the pandemic and respond to it. Businesses, we worked very closely with the Chamber of Commerce, with Visit Cook County to try to make sure that everyone, again, had access to information on how to really significantly modify operations during the pandemic. And then finally, one of our most important collaborative partners has been our Minnesota Response Team, which is over 200 volunteers. As of May 1st, it was 234 volunteers. And those are community members that, said they wanted to help, joined Minnesota Response, and have just consistently shown up to help with everything from packing, delivering grocery orders, staffing the community support line earlier on in the pandemic, and then helping with vaccination events. So total, and this is a little bit dated now, but as of May 1st, they had served over 8,500 hours through the Minnesota Response Program. So we absolutely could not have done it without our volunteers. And even we had a vaccine event on Saturday, and we had one of our dedicated volunteers there screening everyone in. We still have volunteers serving with our response.
Grace, is there some kind of recognition that's being done, or something that we can do?
That is, now that we have kind of a moment to breathe, that is one of our goals for going forward, finding some way to just recognize and thank all of our volunteers for their service. It's been kind of on the back burner for a long time, but I'm hoping that this summer we can put something together, because it's really been just a tremendous part of how we've been able to respond to COVID.
Yeah, very crucial.
Yeah. So this is an interesting set of graphs, and this will look familiar to folks in the local emergency preparedness group. But this on the top shows the waves of COVID throughout the state of Minnesota. And on the bottom, you can see what that's looked like in Cook County. So we've kind of gotten familiar with the way that COVID rises and falls. We have these surges, and then we have these periods where there's less activity going on. And you can actually see, that big spike on the right-hand side, that was the Omicron surge very recently. So of the people who've gotten COVID in Cook County, most of them have gotten COVID in the last 6 to 7 months since the Omicron surge. I did add a little arrow in there because if you want to kind of put a point in time where we started to vaccinate people, we had very few cases at the point at which we were able to roll out the vaccine. So that was really helpful in terms of minimizing the impact of COVID, because at the point at which more and more people were developing COVID, most people had become vaccinated. So it really decreased the probability that people would get sick to the point that they needed hospital level care. So the fact that we were able to roll out the vaccine with very few cases was a huge benefit to the community. This is another image of how COVID moves in waves. This is an image that a group of epidemiologists put together, that they study kind of the movement of diseases like COVID throughout time. So this could be, it could be influenza, it could be another type of viral disease, but it's COVID-19. And they predicted this back in early 2020, and that's exactly what's happened. We have these periods where we're really gearing up to respond. We're having these periods where there's just intense activity, these transitional times, these times where we have a moment to rest, and then it kind of picks back up when there's a new variant, or, it's typically been driven by the variants, to be honest. So reasons that, we could see a wave, there could be seasonal changes, there could be changes in the way that we as humans are behaving to limit the spread of COVID. We have seen that the vaccines become less effective at preventing infection over time, which is why we've seen those boosters rolling out for specific age groups. And then, there could be situations, parts of the country or the world where there aren't very many people vaccinated. So we do see much more activity because of that. So there's many reasons we could see this. And unfortunately, this cycle is likely to continue. Hopefully over time, we'll have longer periods of transition and recovery and shorter, less intense periods of viral activity. But if you think about an illness like influenza that's been around for a long time, we're always sort of on the lookout for if there's pandemic level influenza, if it's a particularly bad flu year. And those would be situations where public health gets more involved to try to educate and provide access to things like vaccines. And some of those key public health messages that really never get old, like washing your hands and staying home when you're sick. So This is sort of what we look at in terms of outbreaks of infectious diseases, and it really isn't all that different with COVID. It's just been much more disruptive on the world these past few years. So this is a nice set of graphs. It actually shows kind of what we've accomplished in numbers in Cook County. So the graph on the left with the green and blue shows our vaccination rates. We continue to have the highest COVID vaccination rates in the state of Minnesota. So that green bar is the percentage of Minnesotans overall that have at least one vaccine dose. In the state, it's somewhere between 60 and 70%. And in Cook County, it's well over 80%. Up to date with vaccines, this is an area where we're doing well. We do have a bit of work to do here. We have 60% of the Cook County population up to date on vaccines, whereas in the state of Minnesota, that's just over 40%. And then you can see kind of the raw numbers of how many people those blue bars represent. It's a tremendous amount of effort put forth by all of our healthcare partners, along with public health and our Minnesota response team. Up to date with vaccination, and this at this point means at least 3 doses of vaccine. So, you know, those 3,000 plus people have gotten 3 or more doses of the COVID vaccine. So just a huge vaccination rollout. And then on the right hand, this is what we call the cumulative case rate per 10,000 people. So it basically is looking at, since the pandemic began, what's the rate of people who've gotten COVID? So how, and in Cook County, it's less than half of what it is for Minnesota overall as a state. So, you know, basically it would mean that people in Cook County are less than half as likely to have gotten COVID since the pandemic began as the state of Minnesota overall. So, you know, numbers are an important part of public health, looking at local data, and I feel like this really illustrates some of the impact of what we've been doing over the past 2+ years. And we've learned a lot. We've learned so much in local public health. I'm sure, you know, everyone has lessons learned. I think some of the things that stick out to me on what we've learned, how to communicate better with our local communities. I've certainly tried to over-communicate, use lots of platforms, really just get those messages out over and over, because the situation has changed so many times, it's been really challenging to keep up with. We've done a lot of work in terms of accessibility, trying to make sure when we've done things like roll out the vaccines that we're reaching out to all parts of our community and making sure that people who have barriers to accessing public health tools, that we try to address those proactively with our partners in the community. And with people who just call up our office and say, hey, you know, I'm having trouble finding masks or tests, or I don't think I'm going to be able to get to this vaccine event. What do you think you can do? So there's been a lot of troubleshooting, and I think that's been key to our response, is really trying to be responsive and help people get what they need to make healthy choices. Lots of collaboration. None of this has happened alone in public health. It's all happened with other community members and community agencies. I think looking at health holistically, we've been very, I think, rightly focused on the physical impacts of the pandemic, but we know, and I'll talk a bit more about this, that there have been pretty significant impacts financially for folks, as well as in terms of mental health. And then, you know, I think our staffing has been key. Having cross-trained staff that are able to step in and support one another has been super important, especially as, you know, we've been impacted as a small team as much as anyone else. We've had kids home in quarantine or with COVID, or we ourselves have gotten sick, and it's been really key to be able to rely on one another to keep the core elements of our pandemic response running, even when the unexpected has come up. Because, as you saw with that slide with all the waves, we don't get a lot of advance notice, and suddenly our workload really has skyrocketed at certain points in the pandemic. And when it calms back down, we're able to move into that recovery phase and look back towards some of our other priority areas. So going back to kind of what my usual update looks like, this is the current situation for COVID. We've had 105 new cases since the last PHHS board meeting on May 17th. bringing us to 1,072 cases overall since the pandemic began. No new deaths related to COVID-19 to report since our last meeting. And at this point, our COVID-19 level remains at medium. So the slides from this presentation will go to you to look at in a bit more detail, but I have gotten questions about, why are we, our numbers have gone up and down, but they don't always seem to logically link to the CDC COVID level. And they really look at 3 different data points. So, and then whichever of these data points is the highest bumps you into the category that is low, medium, or high. So at this point, our case rate is under 200 in the last 7 days, and that's a rate per 100,000. But our regional COVID-19 hospital admission rate bumps us up into that medium zone because it's over 10. So that's why, even though it seems like we have a low number of cases, we still are seeing more of a burden with new hospitalized cases in the region, and that's what's bumped us into the CDC level of medium. So I've taken questions from community members over the phone on this. I'm always happy to talk more about it, but there's these 3 different pieces of data that they look at to determine what the COVID-19 level is. And it going back to kind of the overall goal that's very related to maintaining our hospital system's capacity to care for people, this is really heavily focused on how well our regional hospital system can care for people. And so when we start to see those admission rates and percent inpatient beds rise, that's a big part of what pushes us into medium or high. It's less focused on the case rate in our county specifically. Very exciting news. I know I've been waiting for this. I know a lot of people with kids in this age range have been waiting for it, but over the weekend, CDC, they recommended the vaccines for the 6-month to 5-year-olds. So FDA and CDC have now both approved it. It went out over the weekend. We're planning a media release to go out today. We're planning a vaccination event at the community center on the 6th. And then it will be available on an ongoing basis at the clinic after that. So the vaccine is quite literally on its way to Cook County for this age group, and it should arrive at some point this week or next week. So there will be, I think nationally, only 1 out of 5 parents say they are planning to vaccinate their child in this age group. So there'll be a large focus on communication, building trust in the vaccines, answering people's questions about the vaccines, working with healthcare providers. They're seen as one of the most trusted sources of information by parents in this age group. So making sure that our local medical providers have tools that they can use to have conversations with parents about vaccination as well. So both Pfizer and Moderna are approved for this age group. The event on the 6th will use Moderna because it's a 2-dose series versus Pfizer, which is 3. So it's a little bit more complicated to do events with Pfizer just because it would be a series of 3 versus a series of 2, but that will be available for people who prefer that over the Moderna vaccine for their children. We do have ongoing vaccination outreach. I think we're planning to really kind of re-engage that more, especially for younger people when the back-to-school time happens with all the sports physicals and parents just visiting the clinic for routine medical exams for their kids. When we are continuing to answer quite a few phone calls from people who've tested positive or events where they have questions about planning or cases, and just providing them information and kind of information on who to call and how long people should stay home and who to contact that might have been affected. We are, later in the agenda, you'll see we are extending our testing contract with ISD 166 to provide once-a-week testing at both the community center and at the free school or the summer meal program at the ISD cafeteria. And that's, again, just to make sure that folks in summer school or summer youth programs continue to have access to routine testing. And we continue to communicate with our over-the-counter test and mask distribution sites and make sure that they have enough masks and tests to be able to give out to folks who might need them. And we have had Lockport reached out to us wanting to be a distribution site. So if there's other businesses in the community, we tried to kind of have geographic representation, but if there's other businesses that want to be a distribution point, we're certainly open to adding more sites where tests and masks are available. And we still continue to have free tests and masks available through the state, and the clinic does as well through the federal government. So combining our forces, we've been able to distribute those to our partner sites in the community, which has been great. All right, so a few things when we look to the future that we're paying attention to aside from kind of the immediate impacts of COVID infection or severe disease. One of them is long COVID, and this is kind of an area where I'd say that we're, as a public health medical community, learning a lot, and there's a lot of unknowns. So this is something that can happen to anyone who's had COVID. It could be somebody who's healthy or somebody who has underlying health conditions. It can also impact someone who's had a more severe case of COVID, but it also can impact someone who's had a very mild case or actually been asymptomatic. So the CDC in late May came out with a study that found approximately 1 in 5 adults have a health condition that might be related to a previous COVID-19 infection. And the symptoms also kind of really run the gamut. So it could be, these are some of, you can see some of them listed up here. The most common are tiredness or fatigue that interferes with daily life, difficulty breathing or shortness of breath, and then, let's see, the other is brain fog or difficulty thinking or concentrating. So there's just a lot to learn in terms of what is the best way to treat people who are suffering from these conditions, and kind of, is there anything we can do proactively? So vaccination does reduce the chance of developing long COVID, but it doesn't eliminate the chance of developing long COVID. So, if we think about how many people, I mentioned earlier, we'd have just over 1,000 cases of COVID in the community. If you think 1 of 5 of those people might have long COVID, some people might have very mild cases of long COVID. Some of them may have had long COVID and then kind of it resolved. But there are a significant number of people in the community who are still suffering from symptoms of long COVID, to varying degrees. I think some people are able to kind of self-manage, and some people do seek medical attention and have even, I can't say how common this is in our local community, but as we look at trends overall, some people who they have to reduce hours at work, and it actually is considered a disability condition. So if it's severe enough, a person could apply for disability benefits. So this is something we're keeping an eye on because it can have an impact on quality of life overall. It can impact work, school, family life, mental health, and ability to thrive. And the impacts can really go beyond just individual health to affect our medical systems, who may need to provide care for a new group of individuals suffering from what looks quite a bit like a chronic health condition, and also the economy if there are people who are needing to reduce hours or leave the workforce because of long COVID. So there's a lot to learn here. I don't think, we could have better data on things like, what percentage of these 1 out of 5 people actually claim disability or need to reduce work hours, or are there treatments that seem to have a meaningful impact here? There's a lot to learn, but it's definitely something to keep an eye on as it could affect all communities, including our local communities in the future and today. Some of these are recycled from our last local local emergency preparedness committee, but I'll go through them quickly anyway, just kind of to reinforce that idea that the impacts of the pandemic have really expanded to affect mental health. So globally, there's been a rise in depression and anxiety, suicidal thoughts, and gaps in access to mental health treatment. There's also been data through the National Institute on Drug Abuse that the number of overdose deaths, this was back from 2020, so I haven't seen more recent data than this, but they've also risen significantly during the pandemic. So CDC came out with a teen mental health survey that went on in 2021. This is when they actually gave the survey to high school students and just showed a really significant impact on teen mental health during the pandemic. So 1 out of 3 high school students experiencing poor mental health, nearly half of students feeling persistently sad or hopeless, and more than 1/3 of high school students who felt like they'd been treated badly or unfairly at school because of race or ethnicity. So I think with all of these, you can't just say this is because of COVID-19, but we can see during the pandemic some pretty significant changes in terms of mental health and overdose rates. The last bullet on here kind of shows a disparity also in LGBTQ student mental health with regards to attempted suicide in the past year compared to heterosexual and male peers. So there's a lot going on. This is all national data. We don't have a good sense of what this looks like locally. We just don't have data on it. So in terms of COVID, I think we will continue to work in COVID for quite some time. I'm really hoping that it will not be as much of a daily workload for us, that we'll be able to share the workload among the 3 staff we have in public health, that we'll be able to kind of balance things like answering questions about isolation, quarantine, working with our distribution partners on tests and masks, talking to people about ways to mitigate COVID spread in businesses, at events. I mean, these are all things we've been doing, and I think we're going to continue to do. But, going back to those last 2 slides, one of the things we started talking about last week was revisiting our community health assessment, which I'll speak a little bit more about in a minute here. But to really look at some of how have the last few years impacted community health? What are people saying? What are people identifying as problems? We do have some local data. We could certainly gather more in the next couple of months here. I think we have a lot of work to do in terms of recovery and looking at where we're at, not just in narrow terms, but in regards to other kind of impacts that might have, and changes in community health that have happened alongside the pandemic. We're also looking at potentially having new surges in the fall and winter, and potentially having boosters with new vaccines at some point in the fall and winter. And this at this point is all sort of in the conversation realm with experts that work in the area of vaccine development and infectious disease monitoring, so epidemiology. I'm not sure that these things will happen, but it's something we're definitely keeping an eye out to, and we know that it might become a bigger part of our work in the fall and winter months. So time will tell. I'm going to shift us into talking a little bit more in depth about what happens outside of the pandemic. So going back to the basics, what is public health? I like this very kind of concise definition. It's what we do together as a society to ensure the conditions in which everyone can be healthy. So this image on the right here, there's been quite a bit of research into what makes a person healthy. And when you dig in, there's a percentage that I think most people think of, which is, going to the doctor regularly, which is very important, that access to health care, both preventative health care and ongoing health care in terms of acute situations, is very important. But when we look at health overall, it's definitely not the whole picture. Quite a bit of it is driven by, behaviors that we take, whether or not a person uses commercial tobacco, eats well, gets enough exercise, drug and alcohol use, sexual activity and behaviors. That's a big portion of what makes up our health status. Our physical environment, so do we have a place to live or to work that's healthy? Are there mold, moisture problems, pest infestations, things like that? Are you living in a place where there's poor air quality that's raising rates of asthma, for example? And then up top, a whole 40% is things like, are you able to get a quality education? Are you able to find meaningful work that provides enough money to meet your basic needs? Do you have support from your family, from your social network? Are you able to, like I said, meet your basic needs with the income you have? Is your community safe? Are you worried about violence and crime? Those are all a big part of what contribute to a person's health and well-being. So again, you look at that and you're like, well, that's bigger than public health. That's kind of the overall definition. And again, we don't, in our public health team, we're not the ones that create all of that, but we definitely play a role in trying to facilitate an environment where these factors are present for more people so that we can see health data for our community improve. So it looks like partnering across sectors. Again, we're not the education portion of the community, but we have partners who work in education every day. We're not necessarily the ones ensuring community safety, but we're gladly working with partners that do. I mean, working with law enforcement, emergency management, making sure we're good partners in collaboration. We're very data driven. We like numbers, as you've seen with the graphs and updates. We like to see what the status is so that we're able to kind of look at both data from surveys, census, things like that, but also qualitative data, so talking to people in the community and seeing what trends are that way as well. And over you'll hear in working with public health talking about the social, environmental, and economic conditions that affect health and health equity. And health equity really means, are there portions of the population that for whatever reason are less likely to experience good health than others? And then why is that? And are there ways you can change that? And much of public health work is really prevention focused. So we often talk about working upstream. So rather than waiting for a problem to occur, trying to kind of head the problem off so that, rather than seeing, for example, this is the first example that comes to mind, but with the clinic, we have a program to check car seats to make sure they're installed correctly. So rather than waiting for traffic accidents where we realize that people are getting hurt because they're not correctly, buckling their kids in their car seat, what if we instead worked upstream and made sure everyone had a car seat that was installed correctly, that they knew how to buckle their kid in? So then rather than responding to accidents, you would just you'd be working upstream and preventing a problem from happening in the first place. So that's really kind of the overall philosophy of public health, that you kind of get more bang for your buck when you work upstream rather than responding to an acute emergency or need, which definitely is part of it, but often we aspire to be a little bit more prevention focused. So I'm going to quickly kind of run through the areas of public health responsibility for local governments. There are 6 of them. So in the state of Minnesota, we have a unique public health model that really is a partnership between the state of Minnesota and our local county health department. And we have funding coming to our county health department from local, state, and federal sources, as well as sometimes foundations or private entities. So we've, for example, worked to secure grants from entities like the North Shore Healthcare Foundation in the past. That would be kind of an example of a private source. So in state statute, there are these 6 areas, and basically they detail what people in Minnesota should expect to receive from local health departments anywhere in the state. So assuring adequate local public health infrastructure, promoting healthy communities and behaviors, preventing the spread of infectious disease, protecting against environmental health hazards, preparing for responding to emergencies, and then assuring health services. So a big part of public health infrastructure is making sure we have those core skills that we can use across different areas of public health priority. A big portion of this is developing our community health assessment and community health improvement plan. This is sort of our compass that guides our work within the department and across these areas of public health responsibility. I have up here our goals from our health improvement plan from the last cycle. And some of you've kind of heard that we're re-engaging those going forward. There's something that we use in program development, in facilitating grant making for the Public Health Fund, making sure that the things that we're doing align with what the community has identified as primary needs. The second area, healthy communities and behaviors, quite a bit of our grant funding addresses this area. This is really looking at how we create healthy policy systems and environments to promote population health. It includes community education and looking at health equity. So specific programs and initiatives would be the SHIP program, WIC, family home visiting, the WIC peer breastfeeding counselor who also now facilitates growing families, foot care clinics, health screenings, car seat checks, various kind of outreach initiatives, and then also facilitating the grant-making process for the Public Health Fund. Infectious disease, this is the one I think everyone's the most familiar with at this point. So this is a really good example of our state-local partnership. So this area is really detecting, reporting, and preventing the transmission of infectious diseases. There are so many infectious diseases, and thankfully we don't often hear about them because they're pretty well under check. But the reason I say it's a key example of our state-local partnership is because often we don't see a lot of these locally, but the state has people who work specifically in these areas. So I kind of listed what the main infectious disease areas are that the state has staff working in. I guess antimicrobial resistance maybe isn't quite the infectious disease, but anyway, when we've seen, for example, I get a report from MDH every few months saying if there's any new tuberculosis case in the county, and almost always, since I've started, it's been 0. But if there were to be a case, I would have technical assistance and support from the state in being able to follow up with that person and ensure that they had the treatment and resources that they need to ensure that we didn't have more transmission of tuberculosis in the community. And quite a few of these diseases are like that. And so we work very closely and get assistance from the state to be able to respond if there is a situation where there's more activity than we would expect. We also get materials. So for example, last week, someone from MDH was here, our regional epidemiologist, giving us information on tick-borne illness to provide to, for example, the state parks and the Forest Service. So we're going to be able to go around and make sure that all of our partners have access to materials. So that's a good example of how that partnership plays out. They have quite a bit of expertise and we're able to work with them when we need to. Environmental health. So this is a big area. I kind of have an image that shows some of the ways that the environment can impact the health of our community. We have an environmental health department within the county that plays a really key role, specifically with septic compliance, well water testing. Again, that state-local partnership. MDH actually has a whole division that inspects all food, pool, lodging establishments in Cook County. And if I ever get complaints from community members, I can make sure that MDH's inspectors know to follow up with the establishment involved. We also received a grant last year to do healthy housing work. So this is a type of environmental health program where we would be able to go into homes, assess them for health hazards, and provide some resources. We just went through that training about a week and a half ago, so we're just in the beginning stages of kind of program development, but that'll be a very exciting service to be able to provide in the community. There's also an opportunity to work with the state. There's some grant funding to do assessments for environmental toxins in preschool screenings starting next fall. So that would be a grant-funded program we'd also be able to support with funding through the state of Minnesota. Emergency preparedness. Again, this sort of goes hand in hand with the COVID response, but it could be a different type of emergency. So sheltering has typically been one of the primary areas that public health emergency preparedness has worked in. When we've had fires in the past, for example, setting up shelter, making sure that people know where they can go to get resources, making sure if people are checking in and have questions about loved ones that we can kind of facilitate communication. With families, there's quite a bit. So this is a grant-funded area of focus as well. There's quite a bit of collaboration that happens in this area with FEMA, with emergency management. We have our local emergency preparedness group as well as regional emergency preparedness groups in Northeast Minnesota. And so this is a huge area of public health focus. And typically we're in the preparedness phase. We don't have emergencies enough to spend the bulk of our time in response, but this is an area where we work very closely with our partners. And finally, the sixth area is assuring health services. So I think COVID was a good example of this. So looking at where is it that we have gaps in terms of things. For example, testing. We realized there was a gap in service with regards to routine testing for our schools and childcare. So we were able to step in and help kind of fill that gap with a relationship with the school district. Vaccination. I mean, think about almost 10,000 vaccinations since the rollout began. That's too much for any one agency in our community to take on. So we were able to bring in volunteers and provide quite a bit of logistical and administrative support for the vaccine rollout. We do have some grants that work in this area. Child and Teen Checkups is the biggest one. It's a program to remind parents to bring their children in for well child appointments and to provide training to our medical providers on how to have a comprehensive well child check. This is an area where a lot of outreach and communications happen, reminders to bring kids in to get their routine vaccines, for example. We also work very closely with the Oral Health Task Force to make sure that we're providing equitable access to dental care. So this is the last of our areas of health responsibility through the state of Minnesota. So again, we kind of touched on this. Where are things going from here? We're going to continue to have one foot in the pandemic response, just watching, waiting, hoping that we don't have to more intensively engage in it in the future, but ready if we do. Looking at secondary effects of the pandemic, such as mental health and well-being, substance misuse. Looking at our community health assessment as a tool to really guide us in how we proceed. Lots of regional collaboration with our community health board and various kind of Northeast Minnesota specific initiatives. Our regional health board has a large grant to improve communications and data efforts in Northeast Minnesota. So that's a project I've become involved with as a CHB member. And the Healthy Housing Grant program development, looking at reviewing grants for the Public Health Fund or facilitating that process with our grant review subcommittee, and really looking at those 6 foundational areas of public health responsibility with kind of a renewed focus because we're able to at this point in time, which feels really good. Also, hiring and onboarding the new SHIP coordinator and doing quite a bit of ongoing work with grants and contract management. As I said, a number of our initiatives are grant funded, so managing and making sure that we have accountability for the grants we receive and the contracts that we have with, for example, the Sawtooth Mountain Clinic is a really important part of our team's work. So that's it for me. It's a long presentation. I'm sorry, I tried to be brief. But I really appreciate the opportunity to talk about kind of what public health does outside of the COVID response. It's just been such a big part of the last 2 years. But really, when I look back at how much of our department's time was focused on infectious disease work prior to March 2020, it was pretty minimal. Like I said, thankfully, most of the infectious diseases are pretty well in check, and we get occasional reports and have consultation with the state on things. But it's been very different since then, and I'm feeling really excited to kind of look back at some of our other areas of responsibility under state statute. So I hope I wasn't too overwhelming, but I'm happy to take questions if they arise either now or in the future. Feel free to reach out if something comes up. And again, thank you for listening.
Thank you, Grace. It was very thorough.
Yep.
Do we have any questions for Grace? Commissioner Storlie.
Thank you. And Grace, as always, thank you for what you have done, what you are doing, and probably what you will be doing. You mentioned that the testing kits are at Lockport. Are there any beyond that?
They're on the west end right now. We have Lockport and we have Clearview, so we don't have any in the Tofte or Schroeder areas, but certainly open to having another site further west on the west end.
And what do they need to do? Just have them
Just
on
give us a
hand?
call. Yep, and then we can drive them down there, and then they get they call us if they need more, or if they have questions.
All right, thanks.
Thank you, Commissioner Storlie. Anyone else have any questions? Comments? Bev, please.
Just to have a comment, I just want to thank Grace. She's been very, very helpful as far as the hub has been concerned over the last 2 years, and questions are popping up all the time, or should we do this, should we do that? And we've always been able to call Grace and her team and for information and that. So thank you. I really appreciate it.
Yeah, absolutely. It's our pleasure.
Yeah, and I just want to thank you for, of course, all of your work throughout the whole pandemic and beyond, but as the situation changes, as our community's needs change, you continue without missing a beat, and it's just really, really valuable to have a continuity of service, and even if something comes up that can be disruptive, it just, from my perspective, seems very smooth. So, very nice work.
Thank you.
Administrator Yorkie.
Yeah. Thanks for a great presentation, Grace. I've said this before in, I think, this meeting or possibly a county board meeting, but the idea of working upstream to prevent problems before they happen is so important. And I think that's really what the work of public health is typically, right? That's where the focus ideally should be if there's not a global pandemic going on. And so I just wanted to call that out as something that's really important, and hope that in the coming years you have more time to focus on that kind of activity and not on responding to fires. So thanks for your great work.
Thank you. Yeah, that's probably both literal and figurative. I hope we don't have to respond to fires either.
All right. Well,
Right. Thank you.
thanks again for the presentation, and I believe next on the agenda is a COVID situational update here. You wrap that in there. Yep. We're caught up.
Long after all.
Yeah, you did a twofer. And that brings us on to the director's report. Allison.
Okay. Well, thank you again, Grace, for your excellent report. I will be brief today. I don't have a lot to share, just knowing that there was going to be a lot of information to cover in Grace's report. So I'll start, as always, with our staff updates. Very excited to be welcoming both Abby and Melissa to our team. Abby, as I said earlier, has been with us since June 1st. She's doing a lot of training, connecting with staff, both local and regional service providers in her new role. Today is Melissa's first day, so a lot of that is yet to come, but some planning around what her schedule and orientation timeline will look like. We conducted interviews last week for the SHIP coordinator position and are continuing to recruit for our 3 other vacant positions, those being the children's mental health case manager. Jade is transitioning over from children's mental health to adult services care coordination today. So we're still working to fill that position. Also, the eligibility specialist position on our economic assistance and healthcare team, and the coordinated response pilot program mental health worker. Those have all been reposted several times, most recently closed last Friday. So hoping to see a list of applicants to consider this week. Finally, our behavioral health team and clinical supervisor position that's proposed, and breaking apart our children and family, that sounds negative, and reorganizing our children and family services team into one team focusing on behavioral health services, one focusing on child welfare and family support. We've developed a draft job description, and that will go through the personnel committee to review and approve. Any questions on staff updates before I move us on? Okay, agency-wide, you heard a bit about this from Grace in her presentation, but our public health fund application period is now open. We sent out a media release a couple weeks ago now, and all of the information on our public health grants to local nonprofits can be found on the PHHS website, on the grants page of the public health section of our website. So that includes a copy of the media release, a link to the online application form, a recording of the virtual information session that we hosted last week, and a copy of the presentation that was shared. So I can ensure that that link is embedded in our minutes, and if any of you would like to see that and are having a hard time finding it, just reach out. The application period closes next Monday, the 27th, for our public health fund. We have brought on 2 new members to our Public Health Fund Review Subcommittee. We had a few members leave the council or leave the subcommittee, so we're happy to be welcoming Jen Sorensen from Grand Portage Health Services to that review subcommittee, as well as Hartley Newell-Acero from the Sawtooth Mountain Clinic. So they will both be participating in the group of folks, primarily community volunteers, who are reviewing those applications and providing recommendations to you all for funding for 2023. Last week, we hosted a meeting to review our current 5-year community health assessment and health improvement plan, reviewing what those goals were and progress made towards those goals collectively over the last few years. This will be the first of many opportunities to engage in this process for our next 5-year plan. Again, you can find a wealth of information on our public health page of the website, including hopefully later today a recording of that meeting that we hosted last week. Finally, under items for board action, we have a request to amend the COVID-19 testing agreement, that partnership that Grace discussed between our department and ISD 166. We will continue to offer testing services both for staff and families and youth programming this summer at the community center and at the ISD 166 school lunch program on Wednesdays. This is free, voluntary, parental consent is required, but again, it really acts as an opportunity for people to access local surveillance testing in some of those higher risk situations, and really helps to relieve the pressure on our medical partners when there are outbreaks in youth programming. That's all I have for updates this morning, so any questions?
Thank you, Allison. Any questions from the board? Commissioner Hawkins?
I do have a question, but it's about the contract. And the original contract that we passed in December was for $40,000 maximum to go through June of '23. So I'm wondering, why are we changing it to August? What was the rationale for that?
That may have been a clerical error. I'll have to look back at that, Commissioner Hawkins, and see why we had such a lengthy term for the initial agreement. It was the intent that just go through the school year, and our hope today in extending that was to extend through the summer.
Okay, well, and holiday yesterday, so I wasn't able to make a phone call to clarify this, and I didn't go back and watch the meeting, but I was chair at the time. And I remember the discussion about why it needed to go into the next school year, why it needed to be, I questioned, why do we need to do it until '23? And it was, we needed to finish out the school year, and we didn't know where COVID's going, and we're going to do it maybe in the fall. We wanted that option. So I was under the impression I was voting for something in December for, it says number 6, duration of agreement, effective date through June 30th, 2023. So I just was wondering.
We can double check on that and get back to you.
I'm happy to follow up on that. There were a few other amendments to the contract that I can draw attention to that would be relevant regardless of the initial term of that agreement when approved in December. One of those being that a lot of the language in the initial agreement referred to a temporary public health educator. Andrea Tofte at that time was a temporary staff person who since applied for and was moved into a permanent position. So that's another term of the agreement that we amended. Likewise, the purpose clause was also amended to be more inclusive of the youth and staff in summer programming. A lot of the language in our initial agreement was very specific to ISD students and staff. The intent of the agreement from the get-go was to open that up to all youth, community-wide, and staff in youth programming. So regardless of any error or on my part with the agreement initially or in revising this amendment, I'm happy to follow up on that, but there were some other relevant changes to that contract.
Yeah, and I guess I'm under the feeling like maybe we should postpone this approval, and we can do it next week when we double-check the dates. I understand your position description of the position, temporary to permanent, but I think that could have easily been adjusted to just say PHHS agrees to provide this service. And we don't have to say we have to hire someone temporary, or we have a contract to do this, so I think we better check the dates and make sure we're not, we approve something through 23, and then this one says we're only going to August, and I just want to make sure legally we're doing it correctly, that we understand what it is we're voting on.
So, Commissioner Hawkins, your concern is that the previous agreement had us going through June of '23, and so you're questioning if we want to shorten that through August of '22, and then you also had questions about the language as far as needing to identify perhaps not needing to identify temporary or permanent, just PHHS, is that?
Yes.
Yeah. So under position in the new contract,
Well,
PHHS agrees to provide the service, just like that?
yeah, to me that made, but I'm not a lawyer, so I know.
Well, that's a good point.
You know,
To that
but
point,
that's where I was going there.
To that point, I will say that I did have County Attorney Molly Hicken review the agreement and the amendment prior to adding it to the agenda.
So my next question then concerns the payment amount. Okay, I was under the impression that the school district was providing up to $40,000 through June of '23, through the next school year. And I'm concerned that this new one that we say, do we know how much we spent or been reimbursed? Because they were supposed to pay for this service. Do we know those numbers? Have we gotten to the 40,000? Is that why we're shortening the time frame?
We certainly have record of how much we've been invoiced to date. I would imagine we aren't anywhere near that 40,000 do not exceed amount. That was the total amount of the grant that ISD received from the state and was willing to pass through to us to support staffing for this service. So if that would be critical information for you to know to act on this, I'd be happy to follow up on that.
So, sorry, but going back, the first two items were the date, right? And then the language of the position, and then, but was there something else besides the dollar amount that I missed before that?
I don't think so.
Okay,
I
okay.
think those were my
Okay.
three, my wonder questions.
Yep, very good questions. Do you feel like you, yeah, to Allison's point about the 40,000 not yet being exhausted, do you feel like you need the specifics before you're comfortable with this?
Yes, I guess I've mentioned this before, sometimes when we are renewing contracts, I like to have the data saying, hey, this is what we did before, this is the data that supports, so yeah, we should continue this, so I'm all about more information. Thanks.
Well, sure, yeah. Thank you. Any other questions or comments from the board? Administrator Yorkie?
Yeah, just to clarify, so, I mean, Commissioner Hawkins, you are correct that the original agreement did have an expiration date of June 23, and I'm just wondering, what is our goal here? What do we need it to say? Is the work, was it expected to just be through the school year just ended, or do we need it to go through
We needed to go through August, so
August of this year.
August of this year, and that was the intent in amending the contract in addition to those two other amendments that were made regarding the staff and the
Okay.
purpose and intent. I also have information from Lori, who's tuned in, of course. And is very responsive to the question.
Nice.
She said that we've spent and received reimbursement from ISD in the amount of $11,000, with approximately $28,000 remaining of that grant through May.
Thank you very much. Well, so that makes me wonder, should we think about having this go through August of 2023, or is that crazy thinking?
That would be a conversation that I would have to have with ISD 166. And again, I believe that this was a clerical error in having it be 2023 and not 2022. It's not customary for us to have multi-year agreements. Often we're renewing those on an annual basis, even if it is a longer grant period, in the example of some of our public health grants. So that's my assumption. I'd be happy to go back and check that. And as to whether or not we would continue to offer this testing service for the next school year, that would be a conversation both with our team and ISD 166, if this is something that they were willing to continue to support.
We'd either amend it or do a new agreement for that.
Exactly,
Yeah.
yeah.
Okay. What are your thoughts about the position language? Is that something that is problematic or beneficial to change that? From PHHS agrees to employ a public health educator to provide the service to PHHS agrees to provide the service. Is that administratively significant?
I don't think so. I think more significant is the change from temporary to permanent from my perspective, and any further changes to the language I would want to consult with our county attorney on.
Thank you. Any other questions from anybody? So to proceed, does the board want to table this to review, or do we want to pass this and then amend if we need to down the road? Or what kind of clarifications are we looking for?
I will make a motion to table this.
Okay. I think, is there support?
My question would be important to you. If we table it now, it'll be another month, and you're looking at some time factors here. How do you feel about that?
Again, I would want to consult with our county attorney on this, but I imagine that because of this error, the agreement extends through August, there wouldn't be a concern about continuing to offer the service in the month until I can clarify and bring the agreement forward next month. So I would, whatever this board is comfortable with approving, I think we can make work operationally.
Okay. I just want to make sure, Mr. Chair and Allison, that our students are covered and our staff. I don't want any gaps.
All right, so there was a motion that failed for a second to table it. Then I would entertain a motion, a different motion.
Mr. Chair, I would motion to approve the, as written.
Thank you, Commissioner Svaleson. Is there support?
Sullivan supports.
Thank you, Commissioner Sullivan. Further discussion? It'll be very nice to get clarification from Attorney Hicken, and then just I think it's probably important to review the date discrepancies just to get to the bottom of that more. So, thank you, Lori, for watching and getting quick response on the dollar amount. That's helpful to the conversation. Any other discussion? All in favor?
Aye.
Aye. Opposed?
Nay.
Motion carries 6-1. Thank you very much. And that moves us down to committee reports. And we have plenty of time there. Active Living Steering Committee, Commissioner Svaleson.
Yeah, we had our meeting on Tuesday, June 7th. Mostly just a recap of the activities that had been set up and aligned to go through, and anxiously awaiting to hear the results of the interviews and applicants for the new ship coordinator position.
Thank you. AOA, I attended virtually this last Wednesday, and I guess the big takeaway is, well, just a lot of success there and a lot of perseverance, but also a lot of challenges, largely with staffing and supply chain issues. But they're not quitting by any means. The housing projects are making progress. There's having some hirings there, and that's really exciting. I didn't hear anything specific about Cook County in terms of that for this go around, but had some good feedback from the previous meeting there. I don't know, Bev, were you able to? Were you?
I wasn't
No.
at that
Okay.
meeting.
Yeah. Can't always see who's on
Yeah.
at the same time, but yeah, those challenges range from transportation to Head Start, and of course the state legislative session kind of makes things harder for AOA as well, but that's probably all our part for that. Arrowhead Health Alliance, we did meet, and that was one of the areas that the legislature did make progress on and passed, and so there is funding for to help with the Moose Lake closure fund that is recognized by MDH, and so they're figuring that into the formula. We still don't have specifics on the formula, so there's still a little bit of anxiety there, but there is money approved, and we'll be going over that formula as well. So it was a breath of, we could breathe easier with that news and that progress from the state. ARC, Mr. Hawkins.
We had our meeting here on Friday, and everybody appreciated the lovely weather we were having.
And donuts.
And
Don't forget
yes,
donuts.
That's right. So it was a good meeting, and I was glad that we could host. We haven't hosted here since 2010, they said, I think. We're excited to think that Grand Portage is going to be bringing buffalo down to the meat processing plant, and I think we should all make sure we're there on that day. That would be very exciting to see happen.
That'd be cool. Yeah, good idea.
Mr. Chair, I just wanted to say I really appreciated the opportunity to sit in on that meeting and listen to the discussion by staff. It really gave me a new perspective on the work that ARC does and the really challenging work at times that they do. So thanks for facilitating that.
Yeah, I too really appreciated that and the perspective of that board. I had not been on in those meetings at all before, and it was really interesting to hear just how much overlap there is with the conversations I've had in my public safety committee for AMC, and just the issues that are raised and the real significant needs that our systems are facing. So that was really helpful. I think that meeting was an hour and 15 minutes, and it was scheduled for 2 hours, so that felt like a win. And I did chat afterwards and took up the rest of my gained time. But it was interesting because 2 of the commissioners on that board had to drive 5 hours each way to get here. And I was just, it really made me.
Well, I will be driving 5 hours in August to get there.
I know. It makes me kind of like,
Usually
That's
we
in Duluth.
Duluth,
That
so
makes a
it
whole lot of
makes it
sense. But I do of course see the value of visiting the different regions too. So it's a big ask there. It's a big.
Chair.
Yes, Commissioner Storlie.
And I appreciated just the whole idea of taking care of our young people over there, and I did not realize that there was also a place in Red Wing where they had to remove somebody from this area and take them down there. And just the whole psychology of what they do there is just incredible. It was very eye-opening. Yeah, very, very good to have them here and do it in the future every once in a while. I think for the broader sense of our community understanding, that's a place that we can also benefit from because we pay. We have our dues that we pay to hopefully not, have any big crowd going there, but it's available.
All right, that moves us down to the Community Health Board, and we did meet. And I was mistaken when I gave a report before on some of that funding. I had talked about like $800,000. It almost doubled what that award was. And that was my mistake in that it didn't double. That was just an amended amount, the total amended amount before for that evaluation part of it. So, so it's not as ridiculous as it seemed to me before. But that being said, things are moving forward there. Interviews were done. I was not able to participate, and the position descriptions for the next positions are being written, and Frank CEO, one of our community health board members, has some experience directly related to those positions, and so he's going to give some feedback on the position descriptions as well, the job descriptions. So that's really, really helpful. And otherwise, as Grace pointed out, or maybe she didn't, I guess, specifically like this, but we had the tick-borne presentation at the CHB as well, and that was really informative. Learned a lot, getting in on the data there, and just the trends, and then, wouldn't you know it, I got a tick yesterday, and it attached, it bit, so I was just like, but they can be quick and tricky. And now I just have to monitor and watch and see if there's any symptoms or anything. But it was not there the day before, so I think I'm in the clear as far as any infection is concerned. Local mental health advisory. Rena.
Okay. We met last week. We didn't have too many issues. One thing we did talk about was suicide prevention. That's an ongoing topic, which is very important. And Jerry Lilja brought up that there is a new app called Got Your Back, where you can set up a squad of 4 people that you could call if you feel you need help. And it's a national, they have also YouTube mood tracking and other things. And this, I think, is directed a lot toward teenagers, but for anybody. So that's really a good thing that we could do. And also, there is a new national suicide line, which is 988. And I don't know if it's in effect quite yet or it's coming, but that's instead of a 911, 988 specifically. So that is good. And we also were very happy to have some new employees coming on board in successful interviews, so welcome. And that's about it. We also, well, of course, we're continuing to talk about the book of, about health and good information for us on how to make mental health diagnosis and treatment more effective. It's way behind physical health as far as that goes.
Thank you, Rana. Yeah, just I feel like that group is just really helpful in just making connections and exploring avenues to support the community, and I'm just really grateful for the work that's being done there. Thank you for representing that, too, sharing. That moves us on to restorative justice. Commissioner Hawkins.
Yeah, we had our meeting last week, and the Got Your Back app was also brought up in that discussion. I did check it out online and wondered if we should have a link on our website for, I don't know, I didn't fill out the word thing. I think it's meant for young people, and I realized I'm too old to figure this out.
You're
But,
putting yourself in that box.
I did. I realized, no, but it did look like they had a lot of good information for people, young people. I thought that was geared for, yes. Moving along, and I guess nothing really big to report yet.
All right, thank you. Council on Aging, Commissioner Sullivan.
All right, well, it's been a busy month for the Council on Aging. We've been searching for a cook and a sub-cook, so you'll see that there's been those ads out there, and then we were involved in having a subcommittee put together the Cook County Public Health Fund's 2023 grant, so they are actively working on that. And then we had some very good news this morning. We had our North Shore Healthcare Foundation grant approved for $5,000 for our food program, and thank you, Bev, for doing that. And I also want to thank Bev for her many years of service. As some of you may be aware, Bev has resigned as of next Monday at the hub at our Cook County Council on Aging. So we want to thank you for all those grants you've written and all the work that you've done. Again, we really appreciate all your years of service.
Thank you. It's been very enjoyable. It was a hard decision, but yeah, time for some retirement and enjoyment.
All right. And then emergency preparedness. Grace went over many of the things that we discussed at our meeting. COVID, we talked about fire season, the floods and FEMA. But the good news is we're in such good shape, we're taking the month of July off for meeting. That hasn't been the case for a long time. That group used to meet every other month, and so July is going to be taken off. And we're happy for Grace in particular to have a little time to take a deep breath. Thank you.
Very good, thank you. Healthcare Planning Committee, Commissioner Storlie.
Thank you. Well, yes, we met. We're finally on a schedule now, every other month. Yay. So we almost had to reintroduce ourselves. But we did meet the new Care Partners Coordinator, Julie Wilson, and she was pretty fresh that day coming on board, but, you know, she took the place of Grace Granlund, Kay Granlund, and so Julie is looking for, of course, grants for workers and volunteers, and there's going to be some training for folks who volunteer to help out in the community, whether it be driving or visiting or whatever it is. So she's going to have some training on that. Jen Sorensen put out a request for 2 coordinators. They need one for their gardening up there in Grand Portage. Until that happens, the community members are pitching in to try to get some of the gardens planted. And then they need a Bison Coordinator because they can't get the animals until somebody who understands those big critters can come aboard. So 2 coordinators. So if you know anybody that's a Bison background, call Jen. She needs to have a name. And then one of the great services they have up there is the mammogram bus. And that came up in May, so that's a great service for folks to have the bus drive up for that. Kimber reported on several different things. She appreciates Todd so much in the communication that he does between us and her health care. District 3 needs a board member, a hospital board member, so if anybody knows anybody in District 3. And then unfortunately, she did report that she has 6 beds, that she can't accept any clients because she doesn't have the staff. So, you know, that's just one of the things that she doesn't have staff for. But she said it's very heart-rending because families have people that want to be here but can't. So, you know, there again, it all multiplies, you know. It snowballs to housing and all that sort of thing. But I think we're on a roll now with maybe some future housing. Okay, so then I'll go on to NACO. The 988 number was actually a national movement that we were involved in several years ago under the national level to get that number. And I'm not sure, you know, if it's really activated yet in our area, but it will be. There will be a huge, the summer conference is going to be just outside of Denver, Colorado. And right now, we're kind of working through some of the topics we want to bring up, and a lot of it will center around mental health. I'm not physically going, but if they do have some of the virtual capacity, then I will sign up for it. So April and I will look into that and see if that's going to be possible. It was in February, but I don't know about the mid-season. So that is my report.
Thank you, Commissioner Storlie. Did not meet for the Northeast Minnesota Office of Job Training and have not met with the North Shore Collaborative. That brings us down to PHHS Advisory Council. Bev?
Our next meeting is July 5th, although last, as Allison reported in her report, last Wednesday, we started on the next 5-year community health assessment plan. So there'll be many, many more meetings for that.
Thank you. And for the good of the order, anyone have anything they'd like to share? In which case, I'd entertain a motion to adjourn.
I'll make that motion.
Oh,
I'll second that.
there we are. We are adjourned.